Hello. This session is taking place about noontime on Monday, March 23rd. There are some snowflakes outside, which is somewhat unbelievable given where we are and where we've been this winter. I'm joined today by this esteemed panel, Health Director Dennis Johnson to my left, Superintendent Dr. Paul Freeman, Rick Maynard, our Park and Rec Director, and Mike Shove, the Assistant Fire Chief for Operations, but he's really, I think, the deputy is what we all call him. So thank you for joining me today. What we're trying to do today is just give you, the community, a little sense of what has happened, where we've been, what kind of precautions we have been taking, and where we see the preparations and further precautions going. And also, just an acknowledgement of the seriousness of the situation we find ourselves in. I've been very impressed, for the most part, with the way this community has reacted, seeing people exhibiting the best practices around social distancing. I happen to live down the end of Whitfield Street. That has never been so busy with pedestrians, but it's pretty ironic to see them all walking 5 or 6 feet apart and having conversations. So, but that's exactly what we need to do. And if we don't need to be out in places where a large number of people typically gather, we should avoid doing that. Just a little backdrop. I think we're probably all pretty well aware that we're taking our guidance today and pretty much every day from the experts, the CDC, Center for Disease Control, is it not control, is it? Yeah, it is the disease control. At the federal level, the Department of Public Health at the state level, and then there are the regional planning organizations that we belong to. We're in Region 2, I understand, for the state of Connecticut. So, and also the governor. The governor, as you're probably well aware, declared state of emergency a couple of weeks ago, and he is now up to I in the alphabet in terms of executive orders, and they seem to be coming out fast and furious. And they've ranged from everything from the original was, okay, let's limit it to 250 people. That got scaled down to when one of the next orders to 50. They closed restaurants to sit in and eating, which has created some difficulty in our economy. And then most recently, the decision to close non-essential businesses. Now, I dare say that there isn't a business owner that says they are in the non-essential business category. But nonetheless, the guidance on that came out last night. It can be found on the state on the state websites, on the governor's page, on CGA. And again, that's a pretty interesting list. There seems to be a lot of exceptions, so it doesn't seem as draconian as everyone thought it was going to be at first. I didn't drop shirts off at the dry cleaner on Saturday because I didn't know if I was ever going to be able to get them out in a timely fashion. But it turns out laundromats and dry cleaning establishments are one of those exceptions. So anyway, there are. I advise you to take a look at that and see what you are going to be able to continue to have access to. Locally, I last week made a declaration of a civil preparedness emergency for the town of Guilford. Why did I do that? Because that allows myself and collectively for us to make some take emergency measures to circumvent some of the normal processes that we have related to expenditures or actions, and even allows us to circumvent some of the ordinances that we have in our town code. There was no singular event that triggered that. It just gives us the capacity to do things that we may need to do. I also issued an emergency recommendation, which was to limit social gatherings to no more than 10 people. That was not an order. It was a recommendation. There are some concerns over the enforceability of that, and that will continue to be a challenge for our public safety and police departments. Lastly, I did issue an emergency order on door-to-door solicitation. We got a couple of calls into the Selectman's office that enterprising entrepreneurs were out doing door-to-door. As I think about it, it's pretty interesting. When are you going to find a time with more people home to do door-to-door? But in consultation with Dennis Johnson, it's pretty inadvisable because you've got people coming to the door, they're probably within that 6 foot, the air could be blowing in, and it didn't make sense to allow that to continue to happen. You've heard enough from me. Dennis, you want to give us a little background and status of where we are and what's going on,
Sure.
and what's guiding what you are doing and what decisions you're making?
Sure, Matt, thanks for those community highlights. I'll talk a bit about what's happening locally and statewide and some recommendations on how we can all get together to tackle this emerging virus. As of March 23rd in Connecticut, we have 327 confirmed cases of the COVID-19. We have 208 in Fairfield County, 54 in Hartford County, and 29 in New Haven County. And as you all know, these rates continue to rise up almost exponentially each week. So the virus is here in Connecticut to stay for a while. It's also here in Guilford. The last couple of days, we've been informed that we've had 2 cases in Guilford. One was a 74-year-old male who, after having mild symptoms, is now recovering at home safely. Another one was a 75-year-old male who is actually not a Guilford resident, but was in a Guilford convalescent home recovering, who now has been discharged to the VA hospital. He's also recovering quite well. So we've had 2 cases in Guilford already. In both instances, we made contact with the individuals to make certain they're following up the proper recommended procedures. There's a lot we can do to help stop the spread of this virus. Even though this is a 21st century disease, we have to impart 19th century control measures on it because there is no vaccine, there are no medications to intervene at this point. So there are 3 very important things I want to get across today is prevention tactics for preventing the spread of it. We've learned about how the schools have been closed and the restaurants and business has been shut down. That's the first part, to try to get less congregation of businesses, customers, and employees together in a common area. That's kind of known as social distancing. So one of the most valuable, useful, age-old tactics for preventing the spread of a disease is social distancing. This weekend I noticed a lot of people were out walking down Whitfield Street. It looked like the Easter parade. There were so many people going up and down, and most of them were respectful of their distances to each other. But occasionally you see a group getting together, standing outside a store or in a, talking, visiting socially. It's important to keep in mind you got to keep that 6 foot separation. If you don't want the virus to hitchhike from one person to another, keep the separation. That's the only way in which you can break the back of this epidemic, is to prevent the virus from jumping from one person to the other. 6 feet is a standard old distance to prevent transmission of disease. It works in the Army, it works in countries where there's epidemics, and it's a very important thing. It's a primitive tool to prevent dissemination of viruses, but it's very important that we all practice that. When you go into the grocery store, walking down the aisle, stay 6 feet away from the fellow customers. If you're lining up outside a restaurant waiting for some food, stay 6 feet away. And just be cognizant of that at all the time. You just got to drill that into your mind. Another important tactic is staying home if you are sick. Isolation or quarantine, you may call it. But if you develop any symptoms at home, it's best to just stay home for 14 days and isolate yourself from the rest of your family as best you can. Maybe use a different bathroom or sleep in a different room. But if you can keep the virus at home or in a secluded area instead of bringing it out into the public, going to work when you're still sick or symptoms, a terrible thing to do at this point. But if you can isolate at home for 14 days, it's another proven tactic to help level the curve of the epidemic. So the third most important thing, too, is the basic things we were taught in grade school, in health class. Cover your cough, cover your sneeze, use a hanky, cover into your elbow, wash your hands for at least 20 seconds until your knuckles start to crack, and also practice good personal hygiene. That's one of the most important things we learn at an early age, and it can still apply to us as adults, and it's very important to help stem the spread of the disease, because coming in contact with contaminated viruses and surfaces, you can transmit those from your hand to your mouth, to your eyes, or to somebody else. So those three things, if there's anything you want to get across today at this meeting, is stressing the importance of social distancing, the 6 feet apart, isolation at home if you are sick or your family member is sick. Keep the virus at home where it won't have the opportunity to spread out to the public, and also practice the personal good hygiene. These are really simple little tactics, but it's the only tool we have in our chest at this point to really break this virus. There's promising hope that there might be a vaccine in a year, or there could be some pharmaceutical that might be able to treat some of the symptoms of the virus, but preventing its spread is really up to us acting as a community. So for the protection of our community and the safety of our lovely community here and elsewhere around, practice these three things, and hopefully it'll make a difference in reducing the extent and the duration of this disease.
Dennis, if you don't mind, I've got a couple of questions. The symptoms. This is everybody seems to, is it the flu? Is it the virus? Yeah. The distinction between the two, if you wouldn't mind.
Yeah, thanks, Matt. That's important. The classic symptoms for the COVID virus basically are the fever, fever like above 101.4. Having a cough, particularly a dry, hacking cough, not the wet, moist cough, but the dry, upper hacking cough is a symptom, and also the shortness of breath, which usually follows a little bit later when you start to have lung infection and you have a difficulty breathing. And then also, increasingly more now, they're finding that diarrhea is a symptom as well. They saw a lot of that in about 40% of the cases in China. So, sudden onset of diarrhea, short term, is also an indication you should be concerned. So if you develop any of these symptoms and you're able to stay at home to self-isolate yourself, it's recommended you do that. If you feel that you are reaching a point where your health is going to be compromised, where you're having difficult breathing or serious side effects start to occur, then it's advisable to contact your physician to get either sent to a hospital for treatment and tested. But the State Health Department is recommending that you try to shelter at home to ride out the symptoms if it's possible, because we do have a shortage of tests and maybe a shortage of hospital beds soon to take care of the ill. So it's important to realize these symptoms can also be confused with things like hay fever, which is emerging now, but usually hay fever has more of a runny nose, eyes that are tearing, not so much the fever or the sore throat. So hay fever can also mimic some of the symptoms of COVID-19. And the third thing we have a problem in is flu season at its peak right now. So we have a lot of similar symptoms in the flu category as we do for COVID-19. Flu tends to have more symptoms of body aches and pains, not so much a dry cough, but it has a fever as well. So there's some similarities in the different types of diseases at this time of the year, but the main thing is COVID COVID-19 has the spiking fever with the dry, raspy throat and shortness of breath. And if you're experiencing that right now in our community where we have community transmission of the disease right now, it's probably a good chance that you might be infected. And you should stay at home and consult with your doctor to see if you should get tested at this point. So.
One last one, Dennis, and you talked briefly about getting tested. There's a perception out there in the world that we're all going to be able to get tested. All right, today, the process to get tested, and I will admit this, all you got to do is pick up the newspaper. How come all the NBA stars are getting tested all the time? All right, so what is the process, and the likelihood of someone getting a test locally? How do they have? What are the check marks they have to do to get tested?
Yeah, to get the test approved, first of all, you have to have these symptoms, 2 or 3 of these symptoms. You have to have had a consultation with your doctor, your healthcare provider, and the doctor will have to have issued a permission or a script for you to go get tested. They'll also look at your potential past exposure history. Have you been in a home or in contact with somebody who was a positive case? Have you had extensive travel to an endemic region where there's a lot of COVID virus occurring? And so with those factors together, if your physician feels you are at risk and need to be tested, they will sign a script and you can go to a testing facility at Long Wharf. Here's the closest one to get tested. The reason they have the scrutiny in the testing is because we have a limited number of tests available, and we're trying to utilize most of those tests for patients who are hospitalized who are putting healthcare workers at risk. So we want to know the definition of ill people, whether they're at high risk or if they're contaminated. They could also contaminate healthcare workers and other hospital employees. So right now, the tests are being prioritized for that high-risk group that's potentially contaminated. So you can get tested. There's more test kits every week coming out in Connecticut. I think last week they tested 1,000 individuals. So it's on a case-by-case basis, but there are certain criteria you have to meet to get the test done.
Great. Thank you, Dennis. That's helpful information. Mike, from the emergency preparedness side, I know you probably never, that Bible never leaves your side, right? But anyway, you want to just talk about how we're preparing on the emergency preparedness side?
Absolutely. So on the public safety emergency preparedness, we've been meeting every week, multiple times throughout the week, our emergency planning team throughout the town. So police, fire, selectmen, health department, school system, we've all been meeting at least weekly, if not more, as a group virtually to share information. And we have some virtual dashboards set up. So as information and stuff comes in, we can pass it along so everybody has the latest information. Some of the other things that we're doing from emergency management or 911 or a PSAP center are screening a little bit more advanced for this type of, for COVID-19. So when people call 911, there's going to be maybe a few more questions than usual, so be prepared for that. We've put some information out on our website at Guilford Fire, www.guilfordfire.com. If you go there, you'll also see some advanced PPE precautions that we're wearing. So don't be alarmed, but our first responders are doing a little bit more to protect themselves based on the situation. So we put a picture of what somebody may look like coming to the door. It's a little scary, but most people understand. And even for some fire alarm situations or just some day-to-day calls that we go out on, don't be alarmed. They're going to stay 6 feet back and ask some more questions. So all of that guidance is kind of out on our website of what to expect. We're taking a little bit more advanced precautions with the PPE to protect ourselves as first responders. Some of the other things too in the EM and emergency management side is we're also meeting with our regional and state partners every day at 12 o'clock. We're meeting with our medical directors from Yale Center for EMS. So we're getting the most up-to-date signs and symptoms of what they're seeing at the hospitals for data and what to look out for. So we're putting that information out to our public safety, police, fire, EMS to make sure that everybody has the most up-to-date information on signs and symptoms and ways to protect themselves against those things. Other than the big things is social distancing, hand washing. We're just trying to, we appreciate the school system donated some remaining or some stock PPE equipment, some additional N95s and gloves. We appreciate that. So we're doing everything we can to protect ourselves and the community.
Good. And speaking of that, your folks, your teams are going into harm's way on a daily basis. How do they know if there's already, someone who may be infected or exposed, or other than some of the questions they're asking? Is there any relationship between yourself and the Department of Public Health relative to cases?
Absolutely. As I said, that emergency management team, we're sharing information, and that goes for the same. Sometimes, as after we transport a patient, it could take up to 7 days by the time we get the information back from the hospital. And what we're doing is documenting every case. I would say PPE, we're planning for the worst, so we're taking extra precautions, and sometimes the hospital information is coming back. We're trying to streamline that of how fast that information comes back with testing, so we could also share that information with the health department, so when people come back into the community that they're working with the health department to protect themselves and the community.
Wonderful. Lastly, the world is buzzing about the fact that we don't have enough PPE. How is Guilford doing, and how long do you think we're going to be able to last with the existing supplies? Of course, that's a tough question because you don't know the number of cases, but where are we with the personal protective equipment? That's the PPE stuff, right?
Yes, so I say we're okay for now, for the next couple of weeks, and that again comes thanks to Dennis and the health department and working with some of the resources they had previous to this pandemic, and the school system again for helping support our PPE. We've been working with local vendors. It's really helped. I want to say thank you to Safety Zone. That's another local vendor that we've been working with directly in the last couple of weeks. So we're working really now on PPE for the next, not the next 2 weeks, but week 3, 4, and 5, really trying to source PPE. And that's happening at every local, state, and federal level to try and get their hands on PPE. So right now, we're good for right now, but we're really preparing for the next 3 to 4 to 5 weeks. And a lot of that is going to be contingent upon, as Dennis said, staying below the curve or keeping that curve low, not to overwhelm the healthcare system. In hopes that hopefully, no one has a crystal ball, but hopefully all of this hard work that everybody's doing from social distancing and staying out and away from each other is going to protect us in the long run and keep that call volume low and the spread of this low. So that's kind of the message, is the hand washing, social distancing, and everybody kind of stick to that. It's really going to hopefully help our responses.
Great, Mike. Thank you very much. Dr. Freeman, you've had an interesting couple of weeks. Let us know what's going on.
So the big piece of news from the school system, obviously, is that our schools are closed. Our schools, our 7 schools in Guilford are closed until further notice. Students are not in our school buildings. That's not to say that we're not working. So every teacher in Guilford continues to be working from home. For the last week, our students have had access to materials and activities that we provided on our website to make available to students. There are sources and vendors all over that are providing activities for students while they're home across the country. But today, specifically, our teachers have reached out to be much more actively and directly involved with students. So beginning today and continuing for the foreseeable future, our teachers will be engaging directly with their students through video, through online assignments, through the Google Classroom platform that we use, and through a number of different communication vehicles that we have available. So all students at home should be checking into their Google Classrooms and watching their emails for messages from their teachers. Already this morning, I've heard from families around the community who are excited that there are video messages from principals who are asking students to join them in the Pledge of Allegiance around the town. There have been principals and teachers who are recording book reads for students to access, and again today more actively engaged in that instruction. Buildings do remain available to the community in a very limited sense. Beginning today, our buildings will be locked, but as I said, our teachers and our staff are still available. So if there is any family in the community and any child who needs to retrieve anything from a school, school materials, athletic equipment, or medications from the nurse's office, you may reach out to our schools. We are checking emails, we are checking voicemails, and you can make an appointment to retrieve anything from the building that your child may need to retrieve from one of our buildings. But they will no longer be open for walk-ins to the community without such an appointment. Additionally, there are a lot of questions. We're being asked how long this condition will continue and when students should plan on returning to school. And at that point, to that point, we do not have an answer. We're planning this condition for the foreseeable future. Like everybody else around this table, I'm in contact with state authorities. I have another phone conference with the governor's office scheduled at 5 this afternoon. We're in regular contact with the Commissioner of Education as well as other surrounding school districts, and we're working on the best advice and the best evidence that we have from those organizations. Whether we remain closed through the end of this month, for multiple months, or through the end of the school year, we will continue to be available and continue to be working electronically and from a distance to support our students and our families at home. Additionally, I do want to note, and I know that Rick is going to mention this, that the schools have canceled all of our activities, instructional activities, as well as all extracurricular activities for the time being. But school spaces, town spaces, remain available. If people want to come out and walk or run on the track, I would say that that's an option that is available, but I would reinforce all of the encouragement to continue social distancing practices. Children, students, families should absolutely not be accessing school fields or spaces for contact sports. A pickup football game is not something that should be happening on school property right now. Two friends passing a lacrosse ball is something that could happen on school property. So I would just reinforce all of the encouragement about proper hygiene and proper distancing at this time.
Dr. Freeman, some of the conversations I've had, what if this goes through the end of the school year? Are kids going to graduate, be promoted to the next level, the state minimum 180-day requirements? You got a bunch of graduating seniors. And then it's not like you can hold everybody back for a couple of months because you got an incoming class of kindergartners, and where do you put everybody?
So again, there's a lot of conversation and a lot of moving parts related to those questions. The requirement for 180 physical school days has been waived. And so at this point, we are counting the days last week where we provided access to materials and the days today moving forward where we will be providing distance learning as school days. At this time, we are projecting a final day in school in Guilford of June 19th, as was previously published. There are conversations around the state and the nation now about how our current seniors will meet their graduation requirements and how high school credits will be counted. There's no definitive answer on those questions at this time. The International Baccalaureate program in which we participate has announced that they are waiving end-of-the-year examinations. Students will complete their IB coursework and will receive grades without a final examination grade. The AP, the Advanced Placement Group, through Scholastic or through the College Board, has announced that they're preparing for at-home examinations. So we have students who participate in AP, and it appears that those students will be able to complete their AP coursework digitally with our teachers. They'll be able to take their AP exams at home electronically through the College Board, and they will be able to receive AP credit. We're continue to be involved with the Commissioner and with the State Department of Education around what grades will look like through the end of this school year and how exactly high school credits will be counted through the end of this school year. It's important to note that Guilford's not unique in that. We are with all other Connecticut school districts and in fact school districts across the country as we make those, as we determine those answers, and we'll get information out to students and families as quickly as we possibly can.
It just reminds me of how many moving parts there are to this. One decision impacts so many other different avenues. The one thing I did want to commend the schools and the Board of Education on was the continuation of the food program.
Thank
So
you.
you want to talk on that a little bit?
Yeah, so thank you for reminding us. At this time, our food service remains in process. We recognize our food service delivery as an essential function. Last week, our kitchen staff, our dining services staff, provided 200 meals per day. In fact, 200 combined meals, a breakfast and a lunch combination that families can continue to access and pick up through the schools. Any student or any family in Guilford that has at least one enrolled student of 18 years or younger in a Guilford school can pick up meals for all of the children in their family. You simply need to go onto our website to access a response form. Those meals are free of charge for anybody who accesses those meals, and we anticipate to scale up to about 600 meals per day that we will provide this week. Again, access our website, guilfordschools.org, and you will find information about schools, about distance learning, and about the meals program, all available on our website.
Great. Thanks again for doing that. The community really appreciates it. The feedback I've gotten on that is tremendous. And that's a perfect segue into some other things we're doing in terms of the social network and protecting the services that portions of our community have come to rely upon. Rick, you want to talk a little bit? One of the most difficult decisions early on in this process that I had to make was shutting down the senior food programs, the breakfast and lunches, as well as closing the community center to all senior activities. For so many of our seniors, this is the social center for many of them, right? And for some, it may actually be the only square meal that they get during the day. I know we have Meals on Wheels is a companion to that to our program. But you want to talk a little bit about the impacts and what we're doing and what services are still available for our seniors.
Sure. In fact, I just want to mention when Dennis was talking about shopping, I went grocery shopping and just keep your 6 feet, and I was passing somebody in the aisle, I held my breath as I passed them. When I started to turn blue, I thought, okay, it's time to take a breath again. But people are doing it. They're doing the social distancing. The last lunch we had here a couple of weeks ago, we had about 100, well, just under, because our 100 was the max. We had 99 seniors here. And we announced at that time that that was going to be the last lunch for the foreseeable future. And Meals on Wheels staff were here that day. And we suggested if there were people who really need to get that meal and have it delivered home to sign up. And there were about 8 to sign up that day. And my understanding as of last week, there are 25 additional seniors that have gone on the Meals on Wheels program. So our staff are still cooking the meals here and packaging them, and the Meals on Wheels staff volunteers are here bringing them out to the people who need them. We are still offering transportation on a scaled back basis. We offer rides for medical appointments, and those are dwindling because a lot of doctors' offices, dentists are closed now. But there are some that still need it, and we're still providing bus transportation for those folks. And as right now, we're still providing transportation for shopping for those seniors who need to get to the stores to get their groceries. That's about it, though. We're not doing any other kind of social transportation. And we have a meeting just in a little while, Matt, to talk about some other options for, we're talking with some of our staff to maybe shift gears, and if there's seniors who need to help with grocery shopping or other shopping, we may have some other staff help with that, and we're also looking for volunteers to help with that, which we'll have more conversation in a few minutes on that one. There are a few things that I wanted. We have canceled all of our programs, events, and activities until further notice. All room reservations are canceled. We are still taking registrations, though, for summer at this point. We still have our camps that we expect will still go on. If that changes, then that'll all change. We all don't know this. But in spite of all the no things, there are some things we're saying, no, you can't do this, can't do that. But there are some things we're encouraging. We're encouraging people to go out to the parks. The parks are still open. And as Dr. Freeman said, fields, you can go on the fields, but don't play a football game or any kind of contact sport. We're recommending against basketball in consultation with our health director because now you got multiple people touching that ball. Same thing with tennis, pickleball. Multiple people are touching that ball, and you don't know if somebody's got the virus, and so we're discouraging that. The dog park is open. If people go to the dog park, though, we're suggesting they open the gate with a stick or a tissue or a glove. Don't use a bare hand, because again, any contact that other people are contact, we're trying to eliminate any potential spread of this virus. But we encourage people, go to the beach, keep the 6 feet apart, skim stones, do things you did as a kid, and bring your kids to do those things. Pick up shells, pick up rocks, bring them back home and paint them. You can go to the disc golf course. I was there a couple Sundays ago, and there were 35 people in that hour I was up there playing disc golf. So you can still do that, but keep the 6 feet apart if you're playing with friends. Create a scavenger hunt. Build a tree fort. Do some yard work. There's things you can do still outside, and we encourage people, get outside. Don't stay shut up in the house unless you are quarantining. But there's nothing better, right, Dennis, than getting out and getting fresh air. Keep those safe distances. Go for a walk or a bike ride. So we want to encourage those things. And we also have some of our fitness classes. We're videotaping them. There's segments, little snippets of maybe 5-minute workouts that Ellen from our office taped down at Chittenden Park with some of our instructors last Friday. So you can go on the town's Facebook page and you can find some of those fitness classes, so you can still have that connection with your instructor at home and still do some of the fitness classes. I think I've touched on all the things, but we still do encourage people to visit the parks. Oh, and one thing we did put up online, we emailed out to everybody on our email list, that if you visit the parks and take a selfie, send them in to us, and at the end of March, we'll have a prize of some sort we'll take all those selfies, we'll put them in a box by lottery, we'll pull them out, and we'll have some, I don't know what the prize is yet, we'll have something. And we may do something like that every couple of weeks, issue a little challenge like that for people to get outside and do a selfie doing something, and we'll have some kind of contest and a reward for it.
Rick, I just want to follow up. You talked about volunteers are stepping up and doing stuff. The group that's going to meet in 10 or 15 minutes is largely a volunteer-driven organization. There were several folks who reached out to me, have reached out to you, and we're pulling them together for this very specific program. So I'm not amazed, but I'm just continually pleased to see the level of commitment on the part of our citizenry to helping each other out. So it's just absolutely wonderful. I'm going to just a couple more things. I just want to make sure that the community knows government is still open for business. All right. It is my firm belief, and I think it's shared by everybody at this table, that government has a role to play in providing continuity and stability in times like this. Yes, we are putting some of our staff members at more risk than some of them might be comfortable with, but that's the role of a public servant. So town offices continue to be open, with the exceptions that we just talked about. This facility is closed, Park and Rec is closed, and also the library is closed, but all other departments remain open. We are currently, actually Dennis and I just left a meeting where we're talking with the department heads about how do we skinny down the staff and allow them to work from home. There are some challenges there, technology being one of them, and security around access, but we're working through those things right now, so we can limit the exposure and limit the number of people we have together. So to that end, please, if you need to do business with the town departments, let's try phone or email first, and last resort would be in person. I want to again reiterate that there's plenty of information. There's on your website, the town's website. We got a lot of websites, but it's there, and it's information, because I get confused sometimes with I hear one thing from somebody, tells me something. What's the real story? These are the places we're going to. And utilizing. Again, I want to talk about the mass notification system. For those in the audience who aren't aware of it, there's there's a place to sign up for on the town of Guilford's website, and I've already used that 3 or 4 times to deliver messages to the community. There are a couple other items. I want to talk about the Guilford Foundation. Announced last week that they have some anonymous donors, as well as a Guilford Savings Bank. They are going to be providing financial assistance, gap financial assistance, in the amount of $500 per grantee, that will be managed through the Women and Family Life Center. These are for the folks who are economically disadvantaged by this. There are a lot of folks who aren't working, who aren't earning paychecks right now. So for more information on that, you can check the Guilford Foundation website as well as the Women and Family Life Center to prepare an application. Also, on Friday, I had a couple of conversations with Dr. Chris Moore, who's a resident here in town. He's an ED doc at Yale New Haven Health System, and Barry Felson, who's another activist here in the community. And they're trying to put together a group of docs to do a Zoom conference on Wednesday night, just to talk about, take some of the misconceptions out of the arena. So there'll be more coming on that. We'll be promoting it on the town website, so that may be of interest to you in the community. And then lastly, support your local businesses. This community is what it is for a variety of reasons. One of the things is the kind of shops and restaurants that we have. And remember, these are our neighbors, these are our friends, our fellow citizens whose livelihoods are being impacted by this. So many of the stores, even the non-essential stores, are now going to be allowed to stay open, but only through online ordering and curbside delivery, just the same way the food is being done by the restaurants. So if you don't need something today, maybe go buy a gift certificate that you can use when this is over with. But that kind of bridged financing for some of these shopkeepers and restaurants may be the difference between them staying and making it and not making it through this crisis. That's it for me. Anybody have any final words, or other than stay apart and stay safe, right?
Right.
So thank you for listening to us, and we hope you are all taking the right precautions. Thank you.